Hi my dear OET students. Today I'm gonna take you towards reading part B, which is very interesting and easy subject of reading exam. So in reading part B, you can encounter 6 different nature of questions and you have to choose between multiple choice options. So what you have to do during your reading exam, you are given these questions and you have multiple choice answer options. So first I recommend you to start reading your text, because if you start with your question and answer option and then you read text, then it may jumble up your mind, and if you carry all that stuff in your mind for a moment, it may lead you toward not effectively reading the text. So if you read your text and you understand it well, so you can reach toward the answer option. So here you are provided a text which is about preparation of injection. So I'll read this text and then I'll take you toward the questions. Okay. Lidocaine is a local anesthetic that is often injected subcutaneously before minor medical procedure such as laceration repair, excisional biopsy, and hormone implantation. A key step to prepare for this procedure is clearing a suitable workspace and obtaining any necessary supplies. First, be sure to check with your provider about the concentration and mixture of lidocaine to be used. Epinephrine is often included to constrict local blood vessels for longer duration. Well, now we can move toward the question. In question, I'll read my question and I understand it, and then I'll identify the keyword in the question so that I can reach toward the right answer. Why is epinephrine added to lidocaine injections? Why is epinephrine added to lidocaine injections? So here added is a keyword, because epinephrine, they are asking for addition of epinephrine. So I'll highlight this word. All right, added and epinephrine. Well, so first is to numb the area, or to prolong the effects, or to reduce patient discomfort. So I'll use the rule of elimination here and I'll remove the answers which I think are wrong and are not matching with the text. So this way I'll take A. Either they use epinephrine with lidocaine to numb the area, like for the purpose of numbness. So this statement says lidocaine is a local anesthetic. That means that lidocaine is used for anesthesia to numb the area, not epi. Alright, so this statement is contradictory with this answer option, so I can eliminate this one. Now I'll go for B. Either they use epinephrine to prolong the effects. Okay, so I'm going toward the text and I'll find out if there is something matching with the option B. Here you see in this statement they have told about something to prepare for the injections, and then they say you need to be sure with your provider for the concentration and mixture of lidocaine, and here they are saying that epinephrine is often included to constrict local blood vessels for longer duration. All right, so here you can see that this is exactly matching, that you add epinephrine so that blood vessels could be constricted and it helps to maintain the anesthesia for longer duration. So this is matching with B, but I'll still have to check for C. Either epinephrine is added to reduce patient discomfort. So when I was reading the text, I remembered that I read about something to avoid pain. So pain is a discomfort, maybe there may be something like that. Here you see sodium bicarbonate can also be added to avoid pain during injection due to lidocaine acidic pH. They are saying that you can add sodium bicarbonate with lidocaine so that patient have less pain. So you see they are trying to reduce patient discomfort, but with sodium bicarbonate, not with epinephrine. So this is definitely opposite to the statement of C. because this is not mentioning for sodium bicarbonate, they are asking for epinephrine. So I'm very sure that B is the right answer for that. Well, stay tuned for more. I'll keep updating such stuff, and I'll keep teaching you for the best outcome for your OET exam. Best wishes for OET. Thank you.